Hi, Dr. Brian McGee, physical therapist with Rexercise. So today I want to talk about sciatica, a very common diagnosis. We see lots of patients in the physical therapy office with sciatica, and there's usually a fair amount of confusion as to what exactly sciatica is. So let's give a little background on that. Sciatica occurs when one of the nerve roots in the lumbar spine that supplies the sciatic nerve gets pinched, and that results in pain radiating down the leg. So, for example, if my L4 level on my right gets pinched, say, from a disc herniation, pain will radiate from my back into my butt, around the front of my thigh, to the inside of my calf. And that would be a pretty typical presentation. And this pinching typically occurs because of a disc herniation in our younger patients, younger than about 50, or from arthritis in our older patients. So what exactly do we do for this? In the therapy world, we utilize a series of exercises that we call neural mobilization. It's basically gentle stretching of the sciatic nerve, and it's quite effective. And these exercises really help us do two main things. Number one, they decrease the excitability or irritability of the nerve, and that really helps decrease pain, and it's quite effective at that. Number two, these exercises help restore normal pliability of the nerve. We need these nerves to be kind of stretchy to have normal bending and twisting mobility. So that's what this program is about, decreasing sciatic nerve pain and restoring mobility. I'm only going to demonstrate two exercises, but each will have a bunch of variations depending on symptom severity. So our first exercise for that patient with really the worst symptoms, right? Lots of pain radiating down the leg, lying on the back, grab behind the affected side knee, keep the thigh about vertical. In other words, you're not pulling the leg up this way. Okay, thigh stays about vertical. Keep the toes pointed, and simply extend the knee until you feel some of that kind of sciatic pain, is how patients will usually describe it. Pain will radiate from their hamstring kind of up their butt, sometimes all the way to the back. Hold for a moment and come down. Keep it slow, keep it gentle. Nerves are pretty soft structures. You don't need to stretch hard to create some change. Up and down about 10 times. Now, if this doesn't produce any sense of stretching, what you can do is add a little dorsiflexion of the ankle, which is that, but at the same time, extend the neck. Look up. So the point of the neck extension is we're adding some slack to the spinal cord connective tissue while we're pulling on the other end, on the foot end. So then we take away the slack at the neck, we bring the head to a neutral position, at the same time, bring the leg down. So we have to sort of walk and chew bubblegum at the same time. Extend the knee, extend the ankle, extend the neck, all at the same time. Bring the leg down, bring the head back to a normal position, up and down. Again, keep it slow, keep it gentle. It doesn't feel like a whole lot. Often patients will say to me, what the heck is this doing? But again, we're really helping to decrease that nerve excitability, okay? Now, another version we can do to be a little more aggressive for that patient who maybe doesn't have as severe symptoms or is maybe a little further along in the program is you can kick the leg across yourself a little bit. Same thing with the neck, but so now my leg is moving a little bit to my right as well. So it's a little weird to coordinate, but it can be quite effective. This exercise is a progression from the one we just did. So this is a pretty aggressive stretch. This is for the patient who has had sciatic symptoms probably for months or years. It's pretty chronic. And we've worked our way up to this by doing the prior stretch for some period of time. But again, a pretty aggressive stretch. We don't start out of the gate with this. So in this example, my affected side's my right side. I have a rolled up towel under my spine, just above the crest of my hip bone. The point of the towel is it forces my spine to bend a little bit in such a way that opens the little tunnels in the spine that the nerves have to pass through. So we're applying some stretch at the spine with that towel. Now what I'm going to do is straighten my knee, extend my leg, and then dorsiflex my ankle, and I'm going to feel pull up the back of my leg right up into my low back. I'm simply going to go back and forth. And although I feel a pretty good stretch with this, we're still keeping it gentle. Okay, you're not stretching really aggressively. Feel some pull, but not lasting pain. Okay, about 10 repetitions is good. Now we can get a little more aggressive if I rotate my spine, in this case to my right, so I'm looking up at the ceiling, and now I'm applying a little more stretch. Again, this might be useful for that patient with more chronic symptoms that has worked their way up to this level of intensity. Before I demonstrate the next exercise, I want to remind everybody, click those like buttons, subscribe, leave a comment. That really helps the channel grow. This exercise is simply a sitting version of our first exercise, and that can be helpful. Number one, some patients have a hard time getting up and down from a lying position. Also, for those that work in offices, for example, they can do this at work. So again, you're sitting, sit pretty upright, not a real slouchy posture. Get pretty upright. Extend the affected side knee. Flex the ankle, and just like before, simultaneously extend the neck. And just go up and down. Keep it gentle. Again, the overarching theme of all of these is they're pretty gentle stretches. Keep it kind of slow, not herky-jerky, under control. 10 times, 2, 3, maybe 4 times per day. So those are the 2 exercises I most often include in my patients' programs who have sciatica. Again, I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, leave a comment, and we'll see you in the next video. Try that again.